Hi, and welcome back to the COVID Wellness Support Program. In this first video, we are going to talk about what an operational stress injury is, how it presents, and what are some different things that we can do about it, as well as learning a quick skill at the end that we can implement right away into our daily lives to help cope better with some of the day-to-day stressors. So to begin, what is an operational stress injury? Well, I'm sure I don't really need to tell you, but many frontline and healthcare professions expose their workers to a significant amount of stress. This can come from workplace stressors, so simply the stress of working with such high-need individuals, but also things like harassment within the workplace as well. We also see an increased level of stress right now, of course, due to the pandemic. So combined in your field right now, there's a significant amount of stress that you may be exposed to. So an operational stress injury is an ongoing psychological difficulty that comes from you simply doing your work, doing your job within the healthcare frontline service. And this is when we see that work-related experiences start to have a prolonged and significant negative effect on your day-to-day life. That, in short, is what an operational stress injury is. And so there's a variety of different ways that an operational stress injury can show up. Now, often people think of this as trauma, but it's not often just that. We'll see this present as depression, as anxiety, as obsessive-compulsive disorder. Things like addictions will show up, as we talked about in our last video. Things like pain can show up as well, right? If we're starting to experience increased stress, our muscles get tighter, right? We can experience more injuries as well. And often these exist in combination with one another. It's pretty rare that we'll get just one of these. We'll often see, maybe depression with some anxiety or trauma with some depression, and all the way through this spectrum. And because we have such a variety of different manifestations of an operational stress injury, we get an equally large variety of symptoms that go along with it. So we've talked about before, right, with that mental health continuum model, we might see some symptoms that show up every now and then, right? We might see some disturbed sleep, that irritability that might come up, but this can continue to escalate, right? So we can start to see things like anger and anxiety. We can start seeing intrusive thoughts or suicidal thoughts that might be showing up. Those memories that are coming up unexpectedly, or especially maybe when you're trying to sleep. And we might even see a changing view of ourselves and the world that we live in and those around us. So maybe you are someone that historically believed that the world was a relatively safe place, or that people were maybe inherently good. And as we see these operational stress injuries show up, maybe this view starts to shift. And in that, we'll start to see maybe the world doesn't feel as safe as it used to anymore. Or maybe we don't inherently believe that people are as good as we used to. Right? So as I'm saying this, if these are kind of starting to tick some boxes for you, maybe this is happening to you right now. Now, because we have a variety of symptoms, right, we can have a variety of impacts in our daily life as well. We can have difficulties in our relationships, right? So understandably, if we're maybe more irritable or angry or even withdrawing, right, it's difficult to maintain some of those relationships, be it with a spouse, children, friends, family, colleagues. We see a decreased performance at work, like we talked about within the model. We see maybe a withdrawal from even doing activities that you maybe normally loved doing, right? So maybe you're an avid skier and this upcoming ski season, we're not going to buy that pass, right? We're starting to see a withdrawal from some of those things that you normally love doing. Things like poor personal care and sleep habits, right? Those start to kind of dwindle as well. And we have a decreased tolerance for stress in any environment, whether it's at work or at home. It's difficult to manage those things that are coming up. And I want to put a caveat in here that, of course, some of this is normal, right? We're not meant to be robots. We're not meant to be smooth and operational 100% of the time. It's normal to have fluctuations in mood and attitudes. And a lot of these symptoms might come up as a one-off every now and then, and that's totally okay. But if these are starting to show up in a way that it is negatively impacting your daily life, this is where we're wanting to flag it. This is where maybe we're going to need some more assistance. And again, at the end of this video, there will be a link to where you can find some more of these services within Calgary that can give you some additional assistance if you need. And I would encourage you to look into those if this is starting to tick some more boxes for you. One of the other realms that an OSI, or an operational stress injury, can impact is one's professional quality of life. And in short, what that boils down to is essentially the quality of life that you get from doing the job that you do. And there's a bunch of different factors that play into this. And essentially there's two on either side here. One, we have compassion satisfaction. And this is basically how much pleasure you get from doing your job and getting to do it really well, right? The enjoyment of being able to help others, the enjoyment of showing up and getting to be with your clients, your patients, your colleagues, right? The altruism that goes along with that feeling of feeling good to do good for others. And on the other side, we have compassion fatigue. And this is essentially the bad parts of working in healthcare or frontline service, okay? And this is where we'll start to see two things. The first one being burnout, right? Where it starts to just get hard to do your job on a daily basis. You're maybe starting to feel a bit more ineffective in the job that you're doing. Maybe you're feeling overwhelmed. And a big piece with this is that it's difficult to see hope that it's going to change. So you're feeling maybe stuck where you are right now. So the other part of compassion fatigue that's less common but can still present is work-related traumatic stress. Now there's two components to this, or two types of this that might show up. The first is primary traumatic stress, and this is where you yourself are a direct target of a traumatic event. This is where you feel like your own well-being is put in danger by an event around you, okay? So police officers, military often experience this type of stress. The secondary traumatic exposure is when you experience trauma that someone else has gone through. So this is often really common in things like emergency room physicians or nurses. News reporters can often get this. This is where you're essentially around trauma a lot of the time. So it's not necessarily happening to you. Your well-being is not directly in danger, but you're hearing or seeing or learning about this trauma that has happened to others around you again and again and again. So both of these can come into play and impact compassion fatigue as well. Now, there's a really nice diagram here that illustrates all these components of the professional quality of life. So like we talked about on the left here, we have that compassion satisfaction, the really great parts of doing your job. And then on the left, we have that compassion fatigue that's built of the burnout and that trauma within the workplace, whether it's secondary or primary. Now, the really cool thing about this is even if we are experiencing burnout or even if we have experienced trauma within the workplace, we can override that with the altruism that we experience from compassion satisfaction. It's actually got more power on the green side here, that compassion satisfaction. So if we know how to harness that, we can use that to overcome times of burnout within the workplace and start to feel better and get a better quality of life from the work that we do. Now, there's a couple ways that we can actually measure this. Professional Quality of Life, or ProQOL, actually has a questionnaire that you can go through and see where you're at right now. The nice thing is you can access this. It's online. It's at www.proqol.com. You can go to this website, fill out the questionnaire, you score it yourself, it's entirely private, and the nice thing is that this will give you an idea of where you're falling on this spectrum right now. Maybe you have very high compassion satisfaction and you're doing really great, and that's awesome. Maybe you're experiencing high levels of burnout and we weren't even aware of it. Regardless of what your answer is, it gives you a point to move forward with. So if we know that you have a high level of burnout, we're going to know that we need to do some coping skills to help manage that burnout, and we need to increase that compassion satisfaction to help balance the scale, so to speak. So I'd encourage you to even go through after this video and try this out. Go and complete this questionnaire and see where you currently fall. And then I'd encourage you furthermore after that to do this even on an annual basis as a regular kind of check-in with yourself to see where you're falling and see what actions might need to be taken. The other really great thing about the ProQOL is that it comes with a pocket card that you can print off and put right in your wallet, and you can bring it with you to work. And so if you're starting to feel like you're sliding into a bit of that realm where we're starting to feel that burnout, we're not really happy in the workplace, there are some really easy, tangible things on this card that you can do right away in the workplace that can help increase your compassion satisfaction. It could be as simple as sharing an inside joke with a colleague, or maybe at lunch you do a brief meditation. There's little pieces on that card, little quick things that you can do on a daily basis to help improve your compassion satisfaction. So take a look at the card, take a look at this questionnaire, and really use it to kind of gauge a starting point of different areas that you can improve to be happier and more comfortable on a day-to-day basis. The next thing we're going to talk about here is an operational stress injury and how it presents as a brain injury. And this might sound a little bit surprising because, of course, we're not talking about a concussion in this standpoint or anything like that. But similar to a concussion, there actually are changes within the brain that we see when somebody has an operational stress injury. And this comes from the concept of neuroplasticity. And what neuroplasticity means is that the brain is moldable and it changes based on our experiences and patterns of behavior. It essentially tries to be as efficient as humanly possible for us. And so the more that we do something or the more we're exposed to something, the better those pathways become in our brain. And so essentially, it's trying to make shortcuts for us. It's trying to make life easier. But if we're exposed to things like high levels of stress, this changes the pathways in our brain to incorporate that high level of stress. And so not only do we see stress outside of us, we're now starting to see it inside of us as well. And this happens because the brain actually creates these new neurons and these new pathways based on our experiences and skills. And this can both work in our favor and it can work against us. So if we have these really great coping skills that we're able to use and we practice all of the time, our brain creates pathways that we're able to use them. The same thing happens if we're maybe using skills or coping methods that are not very effective for us. If we're repeatedly telling our brain that we need to do this ineffective coping skill again and again and again, our brain learns to do that and we automatically gravitate towards it in times of stress, which I'm sure you can understand isn't really helpful for us. A nice way of kind of explaining this neuroplasticity is the idea of learning to play an instrument. So if you were to pick up an instrument that you've never played right away today, I bet you'd probably find it pretty difficult to play, right? Probably have trouble hitting the right notes. Maybe you wouldn't be able to make a melody happen. That's pretty normal, right? Our body and brain don't know how to do that yet. But with increased time and increased practice, right, you'll get better and better and it becomes easier and easier and all of a sudden you're able to play this instrument, right? It doesn't happen overnight, but with time and practice you're able to do this. It's the exact same thing with any of the skills that we're going to talk about throughout this entire program, is that they might feel a little bit bumpy and awkward at the beginning. The same way if you're going to pick up an instrument you've never played before. It might feel a little bit bumpy and awkward, but with time and repeated practice, we're going to be able to actually make that so you're able to just fluently use these skills in your day-to-day life. And I'm going to put in a caveat here that this is really why it's so important to attend the things like the optional drop-in skills group, where you're able to practice these skills and make sure that you're using them correctly so that with time, you're able to just use them as a natural part of your daily life. The bonus of this too is even if we have skills or coping skills that we've used in the past that maybe aren't as helpful as they could be, we can actually unlearn these skills. So the same way, I'm sure you can imagine, if you learned to play this instrument beautifully and then you stopped playing it for a while, you didn't practice it, you left it alone, you didn't touch it, most people would actually find it very difficult to come back to it later on and pick it up and just start playing again. Our brain doesn't work like that. And it's because it is always trying to be as efficient as humanly possible for us. So if we don't need that skill anymore, it's going to get rid of it, okay? And the same thing happens with our maybe not so helpful coping skills that we've learned in the past. If we teach our brain that there's a new, better alternative that it can use, we're going to start gravitating towards that one and it's going to get rid of the old ones. So essentially, we can teach an old dog new tricks. This isn't just something for kids and learning and growing through life. This is something that we can mold and adapt as we move through life together. Now, why do we see some of these things, right? If they're not adaptive for us, if they're not helping us, why do we see these things? Why does our brain have this to begin with? And that's because from an evolutionary standpoint, our brain evolved with one basic principle: to keep us alive, to keep us safe. And because of that, we evolved to have a stress response that involves fight, flight, or freeze, right? I'm sure you've probably heard of that before. So if you were to come around a corner and there was a bear there, we have three options, right? We can either run away from the bear, we can freeze and essentially try and hide from the bear, or we can get ready to fight, right? The trick is that that instinct has been ingrained in our brain for so long that we essentially go into today's current stressors with the exact same mentality. So if you go into a work meeting that you're stressed with, essentially your brain's telling you that there might be a bear in that room, which of course is silly, right? We know that there's no bear in that room, but that's what our brain is trying to tell us. And we need to teach it differently. We need to teach it that there isn't actually a bear in this room. We don't actually need to be as afraid or as on guard as maybe we have been in the past. And in times of increased stress, where we see this all the time, like a pandemic, our brain is essentially starting to be on guard all the time, right? And that's where we start to see these OSIs presenting, right? It gets exhausting and hard to be on all of the time. The nice thing is, like I keep saying, we can train our brain out of that. We can train it that we are safe. We can train it to cope better during these times of stress. And that's all comes down to boiling over these skills again and again and again. So, as I've kind of stressed here, what can you do about it? Well, we can learn different ways to manage our mental health. So first and foremost, well done. You've already done bullet point number 1 here, which is learning about OSIs and how they impact your daily living. Now that we know that maybe we have an OSI or how it might be presenting in your life, we need to take action, right? It's one thing to know about it, now we need to do something about it. And the thing that we do about it is we learn these new coping skills and we practice them and we implement them into our daily lives. And again, we can do that either at home or through these drop-in Zoom classes. I again encourage you to attend as many as you can to get as much practice as you can. Beyond doing something like this program or practicing these skills, there are a variety of different interventions that might be available to you. Again, as we were going through that mental health continuum model, if you found that you were falling more into kind of the severe range of some of these different symptoms that might be showing up, maybe we need to explore some more options. And there are tons out there. So the first 4 that are listed here, the cognitive behavioral therapy, behavioral activation, cognitive processing therapy, and dialectic behavioral therapy, offer an intervention that has to do with changing our thoughts and behaviors in response to some of these stressors that we experience in day-to-day life, right? And we're going to talk about that in a future presentation, but it boils down to the concept that our thoughts, behaviors, and feelings are all interconnected, and they seem to kind of work one after another after another. The really cool thing that most of these therapies that I've just spoke about, these first 4, really utilize is the fact that if we can change one of these, we can often change one of the others, okay? So if you're a person that really likes to take action, you're able to change some of these behaviors, you're maybe interested in learning how to change some of your thought processes, one of these first 4 might be a really great fit for you. And I'd encourage you to chat with a professional about which one that might be. The next one here on the list is prolonged exposure. Now, this is another behavioral intervention, but it really stems more towards the trauma side of things. It can be used in other contexts, but it's largely a trauma therapy. But again, it has to do a lot with engaging in different behaviors and maybe different thinking strategies than we have historically in response to some of our trauma behaviors and our trauma symptoms. The next 2 on the list here, EMDR and ART, are again more geared towards that trauma lens. However, they can be used within a different context. These really have to do with focusing on how the brain processes information. So these can be really helpful if you're one of the people that are experiencing maybe some of those intrusive thoughts or memories, right? Maybe nightmares are showing up for you. And essentially all these are is they're indications that our brain has experienced something and it hasn't had an opportunity essentially to digest it and store it away the way that it's supposed to. So it keeps kind of popping back into your head. It hasn't had an opportunity to go all the way through yet. With these 2 different types of therapies, we can actually tell the brain how to process this information so you're able to digest it and then move on. You get to just kind of put it away. The last 2 here, mindfulness and trauma-sensitive yoga, really help with bringing you into the present moment. So I like to describe mindfulness practices as essentially if you imagine having a cup of water. So if you have a cup of water and we pour in some water for thinking about maybe yesterday's meeting and maybe something that happened, a week ago that we're still a little bit worried about. Then we pour in some water for today's concerns, right? We're a little bit, we're thinking about a meeting we have upcoming or a presentation or the kids' recital this evening or something like that. We pour in some more water for, maybe some worries about down the road, right? Maybe some financial concerns for the end of the month, or maybe we have an upcoming trip that we're worried about or planning, different things, right? What's going to happen with the pandemic? And if we keep kind of pouring in this water, because we're thinking about all of these different things from our past, our current moment, and our future, as you can imagine, that glass gets pretty full. And so if I'm going through life and something comes up, a little hiccup, it doesn't take much, that water spills right out of the top. The concept of mindfulness and things like trauma-sensitive yoga help to maintain that cup so that it's less full by only focusing, we're only going to pour in the present moment. Right? So if we're only focused on that present moment, we only have maybe a third of a glass, right? We've got a lot more flexibility in our lives to manage these different things that come up without spilling our cup, right? We're not going to spill over. We're able to kind of maintain life as different things get thrown at us. So there's, as you can see, a ton of different interventions that might be possible for you, depending on who you are as a person and what you feel might work best for you. And again, I would highly encourage you to speak with a mental health clinician or your family doctor to talk about which one of these might be the right fit. People often ask about medication as well and whether medication can help with an operational stress injury. The short answer to this is yes, it can. Medication can improve things like sleep and mood, as well as concentration or anger if we're seeing any of those things presenting in our lives. However, it may or may not be for you. And so I would really encourage you to chat with your general practitioner, your family doctor, to see if this might be an option that you're wanting to pursue. Now that we've gotten through all of this information about what an operational stress injury is, how it presents, how the brain works, we're going to start with our first skill of how we can start to change that brain. We can change these pathways that it's made for us so that we're able to cope better. One of the really easiest and best ways to start doing this is by working with your breath. Sounds simple, right? We're breathing all of the time. So if we're able to control this and we're able to showcase our brain through our breath, that it doesn't need to be on all of the time like it maybe has been recently, it's a really easy skill that we can just bring into our daily lives right away. Now, many of you have probably experienced different ways of doing paced breathing before. Right? If you've ever done a yoga class, right? There's paced breathing in yoga. If you have any military or police training, right? There's tactical breathing that goes along with that. Maybe you've been a singer, you've learned to sing from your diaphragm, right? We get more breath that way. Regardless of which type of breathing exercise you've done, there are 4 main components to every breathing exercise that we want to pay attention to. Number 1 is we want to focus on the breath. Now, this might sound like an easy thing to do, but with our busy minds and the current stressors and the pandemic, it can be really hard to just tell your brain to focus on just one thing. And that's okay. That's currently the way our brains are wired, right? It hasn't learned to do anything else. It hasn't learned to be quiet. So we're going to teach it to do that. And just the same as I said, it's going to feel maybe bumpy and awkward to pick up a new instrument and try and play it. It might feel bumpy and awkward to try and focus only on your breath. And that's okay. As you're doing any type of paced breathing exercise and you're focusing on your breath, if your mind runs away on you, that's okay. That's just what your brain knows how to do right now. I just want you to catch it and just bring it back. It's not a reprimandative thing. We're just going to notice it and bring it right back. And again, as we keep practicing and practicing and practicing, we're going to build that new pathway so we don't have to practice it actually as much. It's going to start coming naturally. Now, the other piece of this is the type of breathing that we do. So we want our breath to be slower and deeper than it normally is. So if you think about kind of in a period of stress, or the bear is a great example. If you came across a bear, right around the corner, your body reacts, right? You get a bit tense, right? And you start to breathe faster and shallower. Now, this is an adaptive response, right? Our body's trying to keep us safe, so it's trying to give us all this oxygen so that we're able to either fight, flight, or freeze. But in these cases, we don't actually need to fight a bear. What we need is to be calm and collected. And what we can do is we can show our body that we can be calm and collected by changing and overriding the breathing that it's telling us to do. So instead of having those short, quick breaths when we're nervous or stressed, we can elongate those breaths, bring them in slower and deeper than we normally do, which you often might associate with things like sleeping, right? If you think about how you breathe when you sleep, how we're generally much more calm at that point in time. That's what we're aiming for. And lastly, we want to really try and focus on that steady breath in and out. A lot of times when we're stressed, and especially when we're breathing out, it might be a bit disconnected as we breathe out. And that's again because it's hard to do, right? We're overriding what our body is trying to tell us to do at that point in time. But again, I want you to start practicing this. And again, more and more with practice, we're going to be able to do this better and better. So I'm going to take you through a brief practice here where we're going to try some of this breathing. So I'm going to get you to get comfortable in wherever you are. Feet comfortable on the floor. You can do this laying down if you like. And all I'm going to get you to do, you can close your eyes if you want, but I'm going to get you to put one hand on your chest and the other hand on your abdomen, okay? And as you notice, I just want you to take stock right away of kind of where are you breathing right now? Are you breathing high up in your chest? Are you breathing into your abdomen? A really easy way to tell is which hand is moving right now. So I'm doing a lot of talking, I'm doing a lot of things, so my chest is the one that's moving right now, okay? And essentially what we want to do is we want to change that. So I'm going to get you to focus on your breath here, and I'm going to get you to try and breathe in and out slowly and smoothly and into your bottom hand. So I want you to try and focus on getting your bottom hand to move as you're breathing in and out. And I'm going to get you to start counting your breath, okay? So I'm going to do a count to 4. This might be too much or too little for you, and that's okay. If you need to count to 3 instead, that's fine. If you want to count to 5 instead, that's okay. So I'm going to close my eyes, and I'm going to breathe in for a count of 4, pause, and then breathe out for a count of 4, focusing on that bottom hand moving, okay? So I'm going to breathe in, 4, pause, out, in, pause, out. If you can, breathe in through your nose, out through your mouth. And keep going at your own pace. Notice as you do this, how much deeper your breath is becoming. And really focus on trying to make it as smooth as you possibly can. Try one more. Okay, so I don't know about you guys, but even just taking that couple of breaths for myself, I'm feeling much calmer in this moment right now. Essentially what I've done is, even though, you guys can't see this, but there's camera stuff all around me and there's a bunch going on, I've been able to remind my body that right here, right now, I am safe. There's no bear in the room with me, and I'm okay. And that's the point of this breathing. Right? We're just trying to slow our body and remind ourselves that generally day to day, we're actually okay. We're actually safe in our current environment. So anytime that you start to feel stressed or anxious or panicked or anything like that in your life, take a moment. This only takes a minute. You don't necessarily have to do the hands. You can do this if you're sitting in a meeting. Just take some of these breaths. Focus on that breathing. I would even encourage you too, if you have trouble falling asleep, this is a great one to do before bed. Just focusing on that breath, counting as you go. It gives you an opportunity to actively slow your body and train your brain that we're safe in this moment, that we don't need to be experiencing that heightened level of stress. So I'm going to challenge you over the next little while here to find 5 minutes a day to practice this. And again, practice makes perfect, and it's going to help it get ingrained into your brain. So the more that you're able to do this, the better. And if the only time you can find for that is before bed, that's okay. But just try and find this opportunity to practice it so it's easier for you to use when you need it. Thank you for joining me for today's session. I look forward to moving forward with you.